So, if I wanted to ask you to find the key words within these passages, do you think you're able to do that? Let me see if I can hold it a little bit straighter. Do you think you're able to find the key words in this passage? And these 3 questions. Do you think you can tell me what they consist of? Do you think you can tell me the difference in them?
Walmart you thought you knew is now new. The best imitations are the ones that...
So, quick tip. I want to let you all know, anytime you're dealing with these questions, normally you will find the answer where it says will be performed, or performed, was performed, anything where it's showing performed. Because guess what? In the CPT area of coding, what is it being done? Performed. See, ICD-10 is for what? Diagnosing, right? CPT is for what? Procedures. You're performing, right? So, you would automatically thought, because you seen basal cell carcinoma, right? That's where we at. So, will be performed using Mohs micrographic surgery technique. That's one. Right up in here. So, you see basal cell carcinoma again, right? And have reconstruction with advancement flap, right? So, we need to know what is it that's being done, right? So, normally at the end of the sentences, because everything else in there, guess what? They for to tell you about how it was cut, this and that, all this other stuff. But what you need to know is that basal cell carcinoma, right nose have reconstructed with an advancement flap. You need to be somewhere with basal cell carcinoma at, which is what? Which lesion is that? Is it benign? Is it malignant? Which areas are those in? Which area has basal cell carcinoma? You need to know that. Also, right up in here, you need to know how to read the passage. So, all of the pus was removed and irrigation was performed. So now we need to understand, 24-year-old patient had an abscess by her vulva, which burst. She has developed a soft tissue infection caused by gas gangrene, which would say the area was debrided. So we already know where we at now, right? Debrided, abscess, vulva, gangrene. We know where we at. Irrigation was performed. So we know where we at. So again, it's about knowing how to dissect the passage real quickly. That is just a tip, you all. So hopefully when I tell y'all that studying is important, studying is important. What do I mean when I say studying is important? Let me show you. You gotta go in and actually study. So on live the other day, I went over taking notes and going in just highlighting, right? You got to go into each section and highlight these codes. You cannot just go in and start, just going in talking about, oh, I know where this is, I know where that is. No, you don't. No, you don't. Studying means you got to go in and actually highlight each code. Not highlight each code as in like you just coloring. You got to go in and understand what you're highlighting. Let me show you. So right up in here, can anybody tell me where we at? Don't look at these because I ain't talking about that. I'm talking about where are we located. I'm going to show you. Autographs, tissue cultured autograph, right? As you can see, Harvey's pinch graft, split thickness autograft, epidermal autograft. Let's flip over. Dermal autograft, split thickness autograft, tissue culture skin autograft, full thickness graft. You see what I'm saying? And it just goes on. You need to highlight where you located at, then turn around, highlight your anatomical site if there's any, highlight your square feet centimeter if there's any, the depth of the body, whatever it is, you need to highlight those things, and also make sure that, and I'm going to tell y'all something else. If y'all didn't know, these are your concepts. You didn't even know the concepts are in your book already. That's why they teach you about what? Concepts. Let me show you. Concepts. You need to know your anatomical site, location, procedure, or service being performed, the type of it, size, length, or width, number, how many are being performed, the time, total time, complexity, simple, intermediate, complex, with or without, guidance, imaging, manipulative, supervision. And the list goes on. But again, you need to know how to go in and prep your manual. You can learn more about it, but you got to follow me.